first, I have to say that this is a crisis that even those who study these studies pandemics, we knew a pandemic was coming. We knew it was just a matter of time. We couldn't predict when. But even this, I think, falls into a black swan category, an event you're not, that really surprises you. In one respect, we knew a pandemic was coming, so maybe it's not a black swan, but the impacts of this certainly, I think, took everybody surprised. And so it will fall in that black swan type category. Our nation at all levels, federal, state, local, and businesses and universities have responded in an unprecedented manner. There'll be plenty of time. We can go. We'll go back. There'll be a lot of finger pointing, a lot of after action at some point in time, and we'll look at the TikTok and who did what when and who not. But I think we need to be looking forward right now, and the response that we've taken is just unprecedented. In fact, I was most impressed by actually businesses and individuals and families and universities began to take action even before some of the government guidance, and even before some of the guidance became more aggressive. It just look, in Austin, for instance, can't cancel the major event of the year before these things became kind of more mandatory. So I think it's unprecedented, the seriousness that we as individuals, businesses, and universities, and took this without actually being forced to do it. And I think that's really unprecedented. I know we all want to get back to work. We all want to know now, when is the peak coming? We all know what an epicurve is. And we know about flattening and crushing the curve. And I'm just as excited about getting on the other side of the curve as you are. From my experience back in the President Bush 43 administration, where we took aggressive actions for pandemic preparedness. And so the phases kind of give us a structure and a framework to think about. Unfortunately, we are in this for the long haul, but there are things we can do to manage the outbreak. And so we've already been through a containment phase. That started essentially when we declared a public health emergency for the United States at the end of January, banned flights and restricted travel in from China. And so that our public health authorities, which was quietly behind the scenes, really ramping up to identify infected people and isolate and do contact tracing. And we're clearly now in phase 2, the mitigation phase, where our only tool in the toolbox actually is very aggressive public health measures and widespread population-wide social distancing, physical separation type measures that we all realize we're in. But we got to move on, and so the next phase, I see the next phase is, again, it's going to be a containment phase, but it's before we have a vaccine. And so we're going to go back to containment. We're going to get on the other side of the curve where we have, we're going to still have infected cases, but hopefully they get down to a level that we can return to containment, where we identify, isolate, diagnose, and treat. But we're going to have to have new tools. We're going to have to give new tools to our public health authorities. We're going to have to give them some technology tools. We're going to have to hire more people. And so forth. We're going to have to use syndromic surveillance so we can kind of pick up where there might be disease hotspots. But this virus is not going to go away. And we have to anticipate it's not going to go away. I hope it does. But we need to plan that it won't. But I also think in this phase 3, before a vaccine is available, I think we're going to have antivirals and antibiotics, and not antibiotics, but antibodies. We're going to have some things to treat. And that'll be important too, particularly if we were to catch the virus and have to be hospitalized, that the antivirals and antibodies may keep us out of the ICU, but even if we get into the ICU, can rescue us. And then we're going to go to phase 4, which is once we have a vaccine, which is a long ways off, maybe 18, 24 months off. That even that would be unprecedented. We can get a vaccine that quick. But we may be having to deal with successive waves of the virus in the future, but a vaccine will help us manage it much better. And then finally, phase 5 is preparedness. And we have to take pandemic preparedness and emerging infectious diseases as a national security issue. These high consequence infectious diseases, we really have to have the political will to invest so this never happens again. And we can do that. We have tools and technologies, but we have to have the political will to do it. So what do we need to get to phase 3? is really, that's where we all want to know is, when is that peak going to hit in our communities, and how high will it be, and when can we go back to work? I wish I could answer that. And But I think we can take solace that we are beginning to see um, some some improvement. You know, you look at New York City, we're starting to see a, a decrease in the number of new cases on a daily basis, and so that's a good news. We're still seeing, you know, a high level of deaths, but those kind of lag 2 weeks, 3 weeks, you know, behind an infection. So even though we're seeing positive signs with smaller numbers of new cases, it'll be another 2 weeks, 3 weeks before we see the death rate, new deaths decrease. But that's a real positive sign that we're beginning to get on the other side of the curve, slowly. But we need to be sustained. We need, you know, at least 10 days, 2 weeks, so forth like that, to know that we're really on the other side of the curve. Texas is probably behind New York, but hopefully our peak is not going to be as high. So far, Texas looks a lot better than other states and a lot of other countries. So I think we can take solace too that our mitigation measures are working in Texas. And so we all don't like this, but I think we can take solace that it looks like it's working, and hopefully we're going to avoid some of the crisis situations that happen in other cities and other countries. I wish I knew those answers, but just to, thinking about it a little bit, we all are going to have a new normal in our lives and our businesses and so forth. And we like the human social interaction, and, sitting around with a meal with friends and colleagues at a restaurant is, something we all enjoy to do. And I'm convinced that the ingenuity and innovation, in our small businesses are going to be kind of key. We see it already in grocery stores. They've been declared essential businesses, and we have to eat and find food every day. But even in the grocery stores, you've seen innovation, like putting the plastic shields up between the cashiers and the customers. And so we're going to see similar type things, I think, in our restaurants, and it'll be phased in. Perhaps a restaurant may at first only 20% occupancy, 25%. I think we'll phase it in, and the innovation to try to decrease and avoid spreading the virus as we slowly begin to reopen um, will become apparent more as we go forward. But I'm a believer in the spirit of our own innovation throughout our society. We just have to look at the crises that have happened. Earlier on, I had to admit that even myself, even though I should have known better, after I saw what happened, because I think the wake up call for many of us, particularly in what I do in my profession, around 23 January, when all of a sudden the Chinese authorities put an aggressive draconian lockdown on Wuhan. That was unprecedented, and that was kind of a wake up call. What's going on here? What do they know that the rest of us don't know? Because the message before that was, we just had an isolated rare pneumonia, unusual pneumonia cases, and it's not human to human transmissible. Well, you don't do that for some. And so that was kind of a wake up call. And it took really a week, for the United States to realize, whoa, this is not a wake, this is much worse than that. And that's when the administration declared emergency, declared, travel restrictions and so forth to slow the spread in the United States, because it was inevitable at that time it was going to get here. A respiratory virus like this, it doesn't know about borders, and people had already flown from Wuhan all over the world when that happened, and so it was just a matter of time. But I do think all of us, beginning, in early February, at the national, state, local, business, we all should have had a little bit more aggressive stance on doing what we needed to do to begin to prepare. At that time, it was too early to do social distancing measures. And there was a lot of stuff going on that we're not aware of as well. Warming up the industrial base. Our scientific enterprise actually leaned forward very, very early on. That's why we already have, I think, in the United States, 3 vaccines in phase 1 clinical trials. And some of the clinical trials for antivirals, our scientific enterprise anticipated and leaned forward. But clearly, by the end of February, we'd reached an inflection point where we had to impose and begin to seriously think about the widespread community mitigations. So we were kind of blinded at first from what was happening in Wuhan, and it took us almost at least a month before we began to realize the seriousness of what was happening in Wuhan and Hubei province. Well, I do worry, and I was worried when we first began to take some of the social distancing measures that we wouldn't understand that we were in it for the long haul. And so we have to be extremely careful right now that we just can't, open wide up and go back to, normal life. We do need to get back to a normal life. We do have to, manage this because we can't stay locked down forever, but we can't let off the gas pedal too quick either. And so we're in it for the long haul. We have to be patient. We're going to have to be innovative as we think about going back to the new normal that we're going to have. And part of that is going to come to our individual family responsibility. Things like we've become really accustomed to now that we didn't pay attention to before, and we should have, even for seasonal flu. Washing our hands, cough etiquette, stay home if sick. If you believe you need to see your healthcare provider, do so. And you believe you might have COVID, call ahead so you know how to do it. All those kind of things are going to be much more ingrained in our society. Things like also disinfecting services is going to be very important. I think we're probably going to see more disinfected of, public places, like subways. We don't have subways in Texas, but we do have some open above ground type, metro, things like that, and buses. So we're going to see, I think, a lot more of that. So we're going to see a new normal. And we're just going to have to take very seriously, how do we avoid becoming sick, and how do we avoid um, passing it on if we may think we'd be sick. And so avoid.